Hello and welcome to The Extra Mile. I'm Linda Boudreau. Our guest today is Scott Hollier. Scott is a physical therapist with offices in Abbeville and Maurice. And I love it when Scott comes because he always gives me little techniques and tips that I can use to feel better. So Scott, welcome. It's good to have you back.
Thank you very much. It's a pleasure to be here, and I look forward to addressing the viewers out there in Acadiana and you, because you are my wonderful patient every year.
And I like to feel good, so it helps me.
And so what we're going to talk about today is we're going to teach you how to take care of you, and by extension of the viewer who is watching, we will get you to do basically 5 movements, comparing the right side of the body with the left side of the body, and attending to any imbalances you have, or any pains or aches or stiffness. If you're aging in a way that you don't like, we can show you ways to attend to those problems and have fun doing it.
That sounds like a plan. And let me just say, as an early disclaimer, if I can do it, anybody in the audience can do it.
That's
because
right.
It's not hard, is it?
No, it's not. In fact, it's part of the protocol that I and many physical therapists use in treating and evaluating patients. So as we get older, we would like to rely on our own self, and many physical therapists educate patients. They train the patient to do these home exercises and put off going to the doctor, or put off taking the pain pill. And it's a physical method to attend to a lot of the musculoskeletal problems that many of our viewers have. And so if you go to a physician, the physician by training treats you with pills, needles, or knives. And so some of those have risks in them.
And invasion.
And lots of them are invasive. And they carry risk. And the physical therapist will teach you how to treat yourself and minimize those risks that are inherent in other forms of treatment. So, but again, the method is physical. If you go to a psychologist or psychiatrist, you are going to talk about your problem.
Right.
If you go to a family practitioner, he's going to treat you biochemically with pills. If you go to a surgeon, they're going to treat you with a knife. All of these are good scientific approaches, but they again carry risk. This form of treatment is physical, so we're going to do that with you as the patient, and we're going to get you to evaluate yourself and then treat yourself.
Okay, I guess before we get into that, I just want to say, I think with physical therapy, maybe more than the others that you talked about, a lot of the responsibility for wellness falls on the patient. Is that true?
Of course it's true. And as we get older, it's important to keep our body mass index, which is a ratio of our height to our weight in proportion to our age. And
what do you mean by that? Like, should we get bigger as we get older, smaller
well,
as we get older?
as you age, we tend to put on a little weight.
Okay.
And as we age, we tend to become a little bit more sedentary than we like. And eventually, the chair that we sit in becomes a position that creates lots and lots of problems. So in the physical methods that we attend to, we're going to teach you how to offset a lot of that. Because as you age, you sit more, and if you sit more, joints stiffen up, you have imbalances, you get out of shape. And for the viewer out there, what I'm about ready to demonstrate and get you to do, I would like them out there to do it.
So they could join me in my trying to, or figuring out kind of assessment, I guess.
That's a good word.
Right,
we call it
okay.
evaluation, but assessment is also
Yeah,
an accurate term.
So you out there can assess yourselves along with me.
That's right. So if the viewer would take part, we would like to show you. And so we're going to ask Ms. Boudreau to take her right arm and straighten it out, and then she lifts it as high as she can. So can you do that for me?
Sure. Let me just get the cameras up.
Yep. And what this does is it attends to her range of motion at the shoulder. So she's going to go all the way up as high as she can, like this.
Okay, and we're just waiting.
And then you put it back down. Good. And then you do your other arm, and you lift it as high as you can. And you ask yourself the question, which one is easier? Is the right arm, right shoulder easier, or is the left arm, left shoulder easier?
I feel like I'm going to get my eye exam, which one's clear.
There you go.
What if they're kind of the same?
Well, they are not. And so you have to get you to move it over and over till you can determine which you think is the easiest to do.
I think the right is the easiest.
Good for you. So now we have determined that your right is easier, and we're assuming that your left is the problem.
Okay.
All right?
Okay.
And the more you use or move your left arm, the more it hurts. So we're going to get you to use the arm that doesn't hurt and lift it up as high as you can for 20 seconds. So here we go. So for her right shoulder and right arm must be lifted as high as she can, as far back as she can for 20 seconds. And so what that will do is it will stretch one side and it will put the opposite side on slack. And so now you can bring it back down.
Okay.
All right? And so the protocol requires that the patient do it twice. So again, you take your right arm out there, your right arm.
And you out there, you do
the
it with
easier arm goes up, and you reach as high as you can, and as far back as you can.
And you hold it for 20.
And you hold it for 20 seconds. And 20 seconds is not 1, 2, 3, 4, 15, 18, 20.
Oh, that's how I was counting.
I know, everyone counts so fast.
So busted.
But it's our full 20 seconds, and so you put it down. Good. And now, after 2 sets of 20 seconds, we're going to attend to the left shoulder.
Okay.
All right, so now you're going to test the left shoulder, lift it as high as you can, and generally it goes back a little bit farther than it did before.
It went up easier.
And it's a feeling, it went up easier.
Yeah.
And without any coaching or prompting, you said the magic words, oh, Scott, it's easier. All right?
Now, why is it after I work this arm that this arm is easier?
That's a good question, and it's a secret, and...
You're not going to tell me?
Oh, gosh. Okay, since you said please.
How long? Is it 20 yet?
Yeah, put it down. This guy. And so the side that was more difficult is now easier.
And not only that, it was easier to hold it for the 20.
It's amazing.
Yeah, it is.
It's amazing. And so if your issue out there in Acadiana, if your issue is left shoulder pain, and if you lifted your right shoulder 20 seconds as high as you can and as far back as you can for 20 seconds twice, it will improve the range of motion of the opposite side.
That's amazing.
And so that's, in the physical therapy world, we call that an indirect treatment.
Because it's kind of counterintuitive, isn't it?
Well, we're taught that we should train and treat symmetrically. What you do to one side, you do to the other.
And I was saying that before the show, they always said that.
That's right. But in the physical therapy world, my good friend Tom DeLonzo Baker out of Raleigh, North Carolina, has come up with an indirect form of treatment, which is asymmetrical. So in other words, you treat the side that's easier to fix the side that's more difficult.
Sounds like myth busting to me.
It may be, but
there you have it.
The proof is in the pudding. And so the viewer out there there are lots and lots of viewers out there who have shoulder problems, shoulder stiffness, shoulder imbalances.
And even if you're young, you can have these problems. I mean, you said earlier as we get older, but I mean, this starts pretty early on.
That's true. With the advent of media, social media, the television,
the phone that we're doing like this
the
all
computer,
the time.
What's happening is that you and I were becoming more bent over. Our shoulders are becoming further and further forward. Our head is too far forward. And all of that weighs on us and creates neck and shoulder problems.
Because gravity is working all the time.
Gravity is a force that we have to contend with, and this is a neat way to utilize
So would an exercise like the arm lift be a good thing to do in the morning when you get up and kind of get yourself kind of moving?
Yes, to your question, but you can do this at any part of the day.
So when you're tired, when you're fatigued,
And the latest research has shown for neck problems, for all you office workers and administrators and managers out there who sit at a desk and a computer all day, just moving your arm above your head will alleviate neck pain. And you can do it for 20 seconds, or you can do it for as long as you wish throughout the day. Not only in the morning, but you could do it every hour on the hour.
Okay.
All right. So we did shoulder raise for the shoulder, but you can do shoulder raises for the neck.
It's the same raise.
It's the same raise.
Okay. So you're affecting everything.
To the side that's easier, and the reason, the science behind it is that the shoulder muscles attach to the neck.
Yeah.
And the neck muscles attached to the shoulder. So there's a lot of reciprocity, one affecting the other out there. All right?
Makes
so
sense.
it affects me too, because I'm human and I have aches and pains. And so I treat myself utilizing this. And so all the patients that I treat watch me treat myself throughout the day. Okay? Because this is a very efficacious way of getting some relief quickly. Now we talked about the shoulder affecting the neck, so now out there we're going to show the viewer how to treat their neck. So I would like you as the patient to fold your arms across your chest.
Like this?
And turn to the right as far as you can. Come back, turn to the left as far as you can. Tell me which way is easier.
Okay, I'm going to kind of give it.
Yeah. There you go.
Oh, the right is definitely
Oh,
easier.
and easy, you notice it immediately.
Oh, yes.
Go and do it again. Do the right, do the left.
Oh, yeah.
Yeah. So the viewer might be able to see her limited range of motion to the left, but her maximum range of motion to the right. All right. What's real cool about this is if you will turn to the right, turn your trunk. Yep. Keep your arms there. Turn to the right as hard as you can for 20 seconds. Now I'm going to talk.
Okay.
As you do this, you are lengthening one side and shortening the other. Number one. Number two, the side that you are turning to has no pain. This is wonderful.
That's true.
Because if you turn to the side that hurts, you're not going to do it too much more.
I'm not going to do 20 seconds.
No, you're not going to do 20 seconds at all. And it may be irritative in nature. So we don't want the viewer out there hurting themselves. So by turning to the side that's easier, you are going to promote a reduction in pain to the opposite side.
So have I been 20 seconds yet?
I believe you have. No,
just
stay there. Just stay there. Good. So take a deep breath. Utilize the breath. Exhale all your air. Turn to the right again. Turn to the side that's easier. There you go. Because in everything that we talk about, we do 2 sets.
Okay.
We always either do the arm raise that we're doing for 20 seconds, twice, and now we're doing the trunk twist to the right twice. Good. 20 seconds is over.
Okay, good.
Now, if you'll turn to the left and notice if there's a little bit more.
There is.
It's just a little bit. Come back.
Not a lot.
No, that's right. Come back to the middle line. So we know it affected the side that's limited a little, but not a lot.
Right.
Okay. So our issue is still limited range of motion to that side. So what we'll do is we'll take you and turn you to the right more. There you go. Oh yes. Inhale. Exhale. Keep doing it. Just stay there. Good. Now for the viewer out there watching, we hope your arms are crossed and you're turning to the right. If you're,
or the left.
But whichever way is the easier way. And you can turn your head to the right too. Turn your head to the right, your eyes to the right, turn everything to the right, and then come back to the middle line. Good. So let's check. Remember, we test and retest constantly out there. So we turn to the right, come back, turn to the left. Notice if turning to the left is somewhat easier.
A little bit.
A little bit, that's right. So you have a major issue in trunk rotation. And so, all right, so put your arms down, and for the viewer out there, turn your head to the right. Good, as far as you can. Turn to the right, good.
Me or the viewer?
Yeah, you. Turn to the right, good. Now turn to the left. Just your neck and head, there you go. So for the viewer out there can see that she has a limitation in cervical spine. Okay? All right. So your limitation may come about from lots and lots of hours filming or reading or being in front of the computer or maybe driving. If the viewer out there watches me, if you're sitting down driving a vehicle, you are not driving a vehicle turning left and right. You are driving looking straight ahead. If the viewer out there is sitting in front of a computer and looking at that monitor, they are stationary, and the only thing that's moving is their hand.
Right.
All right, using the mouse or the keyboard, and nothing else is moving. And so over time, you become restricted in the cervical spine. This is very common.
And so that's what's going on here?
That's right.
Okay.
All right. Yep. So
what do we do about that,
well,
all of us?
We recommend movement.
Okay.
All right, so we've shown you arm raises to attend to the shoulder and the neck, and now we're doing trunk twist to attend to the neck and to the mid-back.
Okay.
All right.
And these movements are enough done repeatedly to kind of start to get
Correct.
some of that.
And again, to the viewer out there, we want you to be moving towards the side that's easier.
Okay.
Not to the difficult side, not to the limited side, not to the painful side. We want to use the good side to fix the bad side.
And we can be asymmetrical.
And you can be asymmetrical. That's right. In fact, asymmetries are very, very common.
Okay.
All right? Now, this is really cool because how many people you know with shoulder problems out there? A ton. How many people with neck problems? A ton. So, even trunk twist will influence the lower back because unknown to you or the viewer out there, trunk twist provides spinal extension. So as you sit down more and more in the recliner or in the car or in the picture show or in front of a desk, you are collapsing. You are bending more and more and more forward like this. And that's contributing to lots and lots of spinal restrictions. So you can pay money to have someone attend to you, or you can save the money and do your arm raise and trunk twist throughout the day to attend to yourself, making you more independent and less dependent upon a practitioner.
And feeling better throughout the day.
And
I mean, you don't
better.
have to wait till you feel really bad to get relief.
Well said, well said. Now, the next part of our method is that we go from sitting to standing.
Okay.
All right? And we do that, and we're going to have you do it. You're going to be our patient, and we're going to have you move the chair back a little bit. And from where you are and where I am, you're just going to go from sitting to standing.
Okay.
All right? But what I would like you to do is I would like you to lean on one leg more so than the other. You can use two legs to stand up, but for demonstrative purposes and treatment purposes, go ahead. Good. Very good. All right. And so I want you to sit back down. Good, and I want you to demonstrate it one more time. So the viewer out there is sitting and watching the program. And just like Ms. Boudreau is doing, she's going to go from sitting to standing. Good, have a seat. All of this is repetitive. And so now this time you're going to go from sitting to standing, but you are going to lean on the opposite leg.
Okay.
And have a seat. And you have to sense, you have to feel which side is easier. Is it easier to lean to the right and stand up, or is it easier to the left to stand up?
For me, it's easier to the right.
Okay, so we have determined that the right side is easier and the left side is more difficult. So to fix Ms. Boudreau's involved side, the left, we're going to get her to stand up 12 times.
Okay, right now?
On the right leg. Now, as you do it, have a seat. As you do it, try and do it with no hands.
Okay.
Good. Go ahead.
Up.
Yep. And then have a seat. There you go. So as she's doing this, going from sitting to standing attends to the large muscles of the body. In fact, this entire method attends to the shoulders, the trunk, the hip, the knee, and the ankle. And just going from sitting to standing is both reprogramming and it's re-strengthening the lower extremity.
I feel it.
Good for you. And as you do this, you're using your big glute muscles, okay, and your big hip joint.
Okay, that was 12.
Oh, good. Have a seat. Have a seat and rest. Okay, because this is physical. This is you have to make a large investment in exertion because it's a physical treatment. It's not a chemical treatment. It's not a surgical treatment. It's not a talk treatment. It's physical. But as our society becomes more sedentary, this lack of physicality weighs on us and creates all kinds of imbalances out there. So just going from sitting to standing will be very helpful. Okay, now since she's done we're going to have her go from sitting to standing now on the side that was more difficult. So this time you go from sitting to standing on your left.
Okay.
And notice how it felt. Have a seat. Do it again. Good. All right.
It feels fine.
It feels fine. That's good.
Yeah.
So in a real short period of time, in less than 90 seconds, her imbalances have been attended to. Her issue may have been hip pain, knee pain, ankle pain, but by going from sitting to standing on the side that's easier, the side that doesn't hurt, will, over time, fix the side that's imbalanced, or has a malady, or has an asymmetry, or perhaps has pathology. So
yeah, I was going to say, what causes some of these imbalances, Scott? Is it just?
Well, there's no one answer. Evidence tells us, scientific evidence, research tells us that our lifestyle trumps genes.
Okay.
Right?
Well.
So if you were born infirmed, or born aged, or born diseased, then that's a different hill to climb. All right? But most people, the human race is not that way. We're not born that way. So over time, we acquire them, we accumulate them. So from grade 1 in grade school to grade 12 in high school, we spend the majority of our time sitting. All right? Now we sit because that's in response to learning the alphabet. So societies that are literate have tables and chairs. Societies that are illiterate have no tables and chairs. So what do? They squat. They squat to eat their meal.
Is squatting better?
Squatting,
rather?
squatting is, well, we're designed to squat.
Oh.
All right, but the chair does not allow us to squat. All right?
Squatting hurts after a short time.
Well, squatting can hurt because the majority of our time we don't spend squatting.
Yeah.
All right? But the more the viewer practices squatting, going from sitting to standing is a squat. All right? Mm-hmm. They'll have less backache, less hip pain, less knee pain. They'll have improved balance.
So a lot of this really is about kind of thinking about what the body was designed to do and finding ways to do that.
Right, and that's what it does. We attend to the body's strength by becoming more physical. And so that's what I want the viewer to experience out there. That's what all my patients experience, because I teach this to them every day. And it's a lot of fun to have somebody right before your very eyes get better just upon their own investment in themselves. And that's what I want the viewer to know. You're investing in yourself.
And you're worth it.
And you're very much worth it. So we talked about balance, and so I'm going to have Miss Boudreau go in the corner against the wall. And as she does that, I want to speak about balance. And as our society becomes more sedentary, as we require more use of the car, before there were automobiles, there were horses and wagons, and before horses and wagons we walked everywhere. And in the European societies and other societies where walking is an everyday occurrence, those folk have less knee pain, less ankle pain, less back pain. They have better balance. And so the old adage, if you don't use it, you lose it, is of prime importance today. And so as us baby boomers age, it's imperative that we become more physical. Now, there may be limitations, and we can attend to the limitations, and so we're going to get Miss Boudreau to, as she stands there in the corner, we're going to have her stand on one leg. And we don't want her to stand using the wall. We want her to stand without a wall. Good. And so normals is anywhere from 10 to 20 seconds of standing on one leg, and she has no problems. And she noticed, I want the viewer to notice that she stood on her left leg first. So now we're going to compare the other side. All right?
Let me get my center of gravity
That's
first
right.
here, because I got to shift it.
And so you'll notice, the viewer will notice that she has to touch the wall a little bit, and that's not her good side. So we would like her to switch back to the original leg, all right? And so the viewer can do this too. The viewer stands up, the viewer stands on one leg, then the viewer stands on the opposite leg. You get to compare which is the easier side, and you and the viewer will now stand on one leg, all right? Which leg is easier for you to stand on, Ms. Boudreau? I don't know.
I don't now the right is okay now that I got my balance.
Yes, okay, stand, but you stood on your left leg first.
Yeah.
Yes, and so this is your standing leg, this is your preference, unknown to you.
Okay, see, I didn't know.
So, as Miss Boudreau stands, and I'm going to join her, what I'd like her to do is go ahead and stand up again on your left leg. And for the viewer out there, you also pick a leg that you stand on. My standing leg, I stand on my right leg, stand on my left leg, I have better balance on my right leg. So if I practice standing on my right leg, it's going to improve the balance on my left leg. In Miss Boudreau's case, as she stands on her left leg, the good leg, the easier leg, that will improve her balance on her right leg. Good.
Yeah, not easy.
So that's very, very, very good to know, because most people are trying to balance on both legs, and in my world, and in the physical therapy world, you can use the good side to fix the bad side. All right? So that's what we want the viewer to know. So it's good to see that you have adapted to that, as well as all patients. And we would like the Acadiana viewer to know that utilizing this physical method of total motion release, you can attend to your neck pain, your shoulder pain, your trunk pain, your back pain, your hip pain, your knee and your ankle pain, plus your balance, just by utilizing the good side to fix the bad side.
And I have to say, Scott, I feel better. I mean, I really, the little kinks are sort of loosened up.
Yeah.
And
it's good that you mentioned that, because that's what the viewer out there is going to experience.
Yes, so
and so
do it. It takes no time at all. Let it be a part of your day. Scott, we're out of time. Thank you for coming back again.
I enjoyed it. Thank you.
Thank you. And thank you for watching The Extra Mile.
Ta-da.
Good show.